This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Hi, welcome to a new episode of Behind the Headlines. I'm Maura Donley, an associate of the Susquehanna Valley Center for Public Policy. Charlie Greenwald, our usual host, is on assignment, and I'm very fortunate to have Dave Atkinson with us today, who's also an associate of the Susquehanna Valley Center for Public Policy. Welcome,
Good to be
Dave.
with you.
Very nice to have you. We've never hosted before, so we're looking forward to that. And we have a great guest today. We are very fortunate to have back with us Andy Carter, who is the President and CEO of the Hospital and Health System Association of Pennsylvania. Welcome, Andy.
Thanks so much, Maura.
Thanks so much for
Dave.
coming back.
My pleasure.
Well, we're right in the thick of budget season here in Pennsylvania, and the governor's working on his budget, and the General Assembly are working on their proposals. So tell us if HAP is working on any specific initiatives related to this year's budget.
Yeah, I'd say at least on a couple of fronts, beginning with a great deal of support for the governor's out-of-the-block budget. It was very supportive of health care in Pennsylvania. It included a stable approach to what we call our provider tax. We tax ourselves, we get some federal money as a match, and it allows us to do two things: help the state general fund and provide more patient care. So the governor endorsed continuing that program as it is. That's a terrific first step, and we're very positive about it. The second area, the governor's budget also provided for essentially the continuation of much needed funding from the Tobacco Settlement Fund. You may remember back in the late 90s, the tobacco industry agreed to pay states a lot of money, largely to offset the outrageous amount of health care costs caused by the damages from smoking. And so the Pennsylvania hospitals get something on the order of $64 million a year from those payments.
Still ongoing.
Still.
That's great.
And that's been hugely important to research. It's been important to making sure hospitals can provide care to the uninsured and to Medicaid beneficiaries. Now, there is a bit of a challenge here, and that is that some people in the General Assembly believe that the structure of the general fund will force the state to stop those tobacco payments. Now, that happens largely because the state a couple of years ago borrowed money and used as collateral the future stream of payments from the settlement fund. Well, we borrowed that money, now it's time to start paying it back.
Oh, goodness.
The governor decided to pay it back using sales and other tax mechanisms, and it allowed the continuation of those very important tobacco payments. But there is a thinking among some in the General Assembly that we can't use general funds or sales tax revenues to repay those bonds, that instead we should use those tobacco payments, which would mean money moving out of patient care, out of research, and using it to pay back those debts. So we're watching that very closely.
Well, that's proof that in the General Assembly, issues never disappear. They merely go on hiatus. And one of the things that Pennsylvania did very well in the past is that they made a commitment that the tobacco settlement funds were going to be only used for health care. Other states put it toward education, social service programs, other needs, but Pennsylvania was relatively unique in terms of the commitment to health care programs. Describe some of the very positive uses that money is put towards, and why there is a concern that if payments stop or money's diverted.
Sure, a couple of good uses. One is keeping financially fragile rural hospitals open. That's a hugely important piece of the strategy that tobacco dollars help support. Those dollars go to roughly 28 of our rural hospitals get funding from the Tobacco Settlement Fund. Now, I don't want to throw a lot of math at you or your viewers, but here's a pretty staggering fact. Last year, more than half of rural hospitals lost money. And somewhere between a quarter and a third of rural hospitals lose money year over year. They're financially fragile, and we may have a chance to talk about steps that the Wolf administration and the hospital community are taking together to address that. But in the meantime, those tobacco funds are vital for keeping the doors open for the 3.4 million Pennsylvanians who live in communities served by these rural hospitals. A second important use is research. We have a lot of work to do just on the basic science of figuring out why we aren't as healthy as we are and what interventions work to make us healthier. And tobacco settlement funding is significant in supporting much of that research, some of it happening at our larger academic medical centers. So those two examples of critical work being done that this money supports.
We've talked a lot in the past with you about the opioid crisis. Is any of that money going towards trying to solve some of those issues?
I don't believe that this particular money is directly supporting much of the work being done on opioids. There are important investments underway to support work on opioid use disorder. I hope to be able to announce soon that we are launching a project to help hospitals work together better to combat the opioid use disorder. We're working closely with the Wolf administration, the Department of Health. Dr. Levine is leading the charge on making sure that government is doing its part to create and fund centers of excellence for treating opioid use disorder. However, the tobacco funding is not directly supporting that. Now, could I imagine a day in which pharmaceutical companies might find themselves entering into an agreement that looks something like the Tobacco Settlement Master Agreement? That's something that all of us as policymakers may want to take a look at in the future. I should also mention, another reason the governor's budget is an important blueprint is that it continues funding for Pennsylvania's critical access hospitals. Special funding goes to 15 of them, again, to help them keep their doors open. That's something on the order of $10 million. And as I think about all the challenges in creating access to health care for Pennsylvanians, one of them is obstetrics care and maternity services. We've seen a devastating hit to access to maternity care, particularly in rural communities. Since 2050, maternity programs have closed in the Commonwealth. Uniontown Hospital just announced, out in Fayette County, just announced the closure of its maternity services. And the governor's budget includes funding to support those obstetrics programs that still exist. That's hugely important.
And it's evidence that the medical malpractice crisis has not been entirely solved, because that what prompted a lot of those closures in the first decade of this century. And so it's something that when we talk about patient access to quality and affordable care, price is not the only determinant. Distance matters too.
It sure does. And you mentioned an issue that we spent some time, I think one of my colleagues from HAP talked to you a couple of months ago about attempts. There was a major reforms to the medical liability climate in Pennsylvania, as you mentioned earlier part of this century. And there is an effort to go back to what I would call the dark ages, when medical liability costs were soaring, and an effort to change these so-called venue rules, which would allow a case to move, say, from Lancaster County into Philadelphia County, which
Your judgments are often quite big.
Exactly. And we have done some research with our colleagues in the business community and the physician community that document the threat of huge increases in liability costs. And those are costs that end up getting shifted to all of us as Pennsylvanians. And Dave, as you note, it can have an impact on availability of services. So it's a huge threat. Fortunately, because we stood together and fought back, any consideration of a rule in the Supreme Court has been delayed for almost another year. And that'll give us a chance to continue making the point that we have to have a responsible medical liability environment in Pennsylvania.
So an issue that I know probably every one of our viewers deals with is the idea that you have to have prior authorization before you can have a procedure done or a medical test run. And I think we all know all about that. I understand there's some movement to change that or make that a little bit easier for patients. Can you tell us a little bit about that?
Yeah, I'd like to thank Representative Stephen Mentzer's effort to lead the General Assembly towards reform of, you call it prior authorization, I call it red tape.
Oh,
It's reasonable.
I like that better. Yeah.
I mean, it is reasonable that an insurance company not pay for unnecessary medical care. We don't want to. We don't want our premiums to be needlessly high because we're paying for a bunch of useless health care. But we have to find the middle point. Mm-hmm. The red tape is getting really tough, and I hear it as I travel around the Commonwealth. One of the first things that my members point out to me is the frustration their physicians face in just trying to get through the red tape set up by insurance companies. I'll give you an example, and it really pains me to even talk about this case. A 90-year-old woman who is suffering from chronic, debilitating spinal back pain. Her surgeon recommends that she have a procedure, and he has to go through a 2-week process. Now, during that 2-week process, this patient, this is a real story provided to me by a member, she had a flare-up of her pain that was so bad she had to go to the emergency department and receive care there for pain relief. So that incurred costs.
Huge costs.
Be discharged. Finally, the care was approved, but after this long wait, the cost was in the end higher. So Representative Mentzer's legislation would establish standards where these turnaround times have to be much shorter, and that it would require that if the procedure is a surgical procedure, we don't have somebody that's not qualified to judge whether it's a needed procedure, such as a nurse or a respiratory therapist who's working for the insurance company. It ought to be a surgeon. So,
as a wrap-up,
yeah,
one of the things that is on the horizon, Rural Health Initiative. You're part and parcel of that effort.
It's being watched from around the country, recognizing the financial challenges facing rural hospitals, recognizing that rural communities are terrified of losing access to their beloved community hospital. The Commonwealth, the hospital community, and the federal government have teamed up with rural hospitals and insurance companies to create a new pilot project. And here's the deal. And we have 5 member hospitals that have signed up for this bargain. In exchange for a set amount of money, a budgeted payment stream that you know about at the beginning of the year, the hospitals will work to transform the kind of care they're providing. And the kind of care they will provide, it will be better matched with community needs. So instead of necessarily having a heart program, which might be better provided maybe some distance away, invest more in behavioral health services, home health care services, obstetric services, what that community needs. Those kinds of transformations are hard to do if you're worried that the money's going to evaporate while you're transforming.
Sure.
This pilot ensures that the money is there, gives you a safety net. So we'll see how it works.
This sounds like an issue we ought to spend a lot more time on. So we want to thank you so much for being here today. We hope you'll be back really soon. I'd like to thank you, Dave, for joining me here today. It's been a pleasure. And we'll stay tuned for the next segment of Behind the Headlines.
Behind the Headlines is brought to you as a public service by the Pennsylvania State Association of Township Supervisors, the largest, most influential municipal association in the Commonwealth. Since 1921, PSATS has been preserving and strengthening township government and securing greater visibility and involvement for townships in the state and federal political arenas. Covering 95% of Pennsylvania's land mass, townships represent 5.5 million residents, more than any other type of political subdivision in Pennsylvania. Behind the Headlines is also brought to you by the Hospital and Healthsystem Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Chamber of Business and Industry. The Pennsylvania Chamber serves as the frontline advocate for business on Pennsylvania's Capitol Hill by influencing the legislative, regulatory, and judicial branches of state government. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org.
Hi, welcome back to Behind the Headlines. On this segment of Behind the Headlines, we're fortunate enough to have Mr. Ed Arnold join us again for another Arnold Report. Mr. Arnold is the president of Susquehanna Valley Center for Public Policy and has a history of being one of the leading businessmen in Pennsylvania. Ed, welcome back to the show.
Nice to see you, Charlie.
Nice to see you, too. Well, we have a couple new questions here from our viewers across Pennsylvania who want to tap into your expertise. The first one is very much in the news and is of interest to the Lieutenant Governor. Yeah. The first one is, do you think that it's wise to invest in any cannabis stocks when marijuana is still considered to be illegal by our federal government? What do you think about that? Would you advise people to run out and buy marijuana stocks when the federal government says this is illegal?
It's a booming industry. Its time has come. First of all, Canada, it is legal now. It's probably going to become all these stocks they sell where you can sell. And Mexico is probably going to make it legal. And very frankly, 26 states medical marijuana, which is realistically a real medicine, is legal. I think eventually the federal government will, so it's up to the states, and therefore the states will decide what to do. I just do not see us cracking down on it because it is just too popular. So overall, the answer is, as always, it's be a small part of your portfolio. It's a very difficult investment because there's no companies really making any money. Probably get to an exchange-traded fund where it has a variety of stocks, rather than you trying to pick an individual company, which would be very, very hard.
Very interesting. A second viewer is asking you today, is it better to retire abroad than here in the United States in order to save money? And if it is, what countries would be the best ones for Americans to retire to in order to save the greatest amount of money?
First of all, if you go to a low-cost country, which there are a fair number, in fact, most countries would be less expensive than the United States, it would be, yes, it would definitely be less expensive. The question is your quality of life or your comfort. Therefore, you have two things there. Is language. There's X number. English is fairly common, but you could be in some countries that English is fairly weak, and therefore, and safety, of course, is another criteria, and even their attitude towards Americans. So there's a lot of things to consider because you're still talking about quality of life. So yes, it's less expensive. Again, looking at the English-speaking countries, Canada, Australia, New Zealand, they're more and more hard to get into. They just don't. They generally have to be qualified because they will tend to go into their medical system. So overall, to say that the only English-speaking country I think you can easily go to is Belize, which happens to be basically a very safe country, and it's all English. It was a British colony at one time, and it's still, Britain is very active in it, protecting it. But basically, you have your Spanish countries, something like Costa Rica or Panama or Chile, but they're Spanish.
If we're speaking about retirement, you have touched on this subject before, Ed, but we have other viewers who have missed one or two of our installments, perhaps. But we have another question for you on if you would please sort of enumerate the top tips to prepare for retirement. What should a person do? What should a family do? If they're thinking of retirement, how should they plan for it, Ed?
Well, first of all, the first advice is wait. That overall, you got to realize when you retire, you're probably going to live for 20 years. And in a 20-year time frame, probably costs to live are going to double. I mean, what we're talking about, and we actually have this in several different questions here, but overall, you're talking about medicine, number one, is a big wild card. A lot of people become very financially strained because of their health deterioration and therefore the co-pays and so on. Yes, we have basic government insurance, Medicare, and so on, but it doesn't cover everything.
Sometimes they'll need new medicines, or sometimes the cost of their medicine will increase.
That's right. So even your co-pays can get very expensive. So medicine, entertainment, if you're going to retire, you want a quality of life. Entertainment is getting very expensive.
I think that's something that's overlooked, Ed.
Yeah, I think it is, really. I mean, you look at what, well, first of all, you know what entertainers, whether they're Hollywood or whether they're sports people, are making tremendous monies. Well, obviously, you're paying for that. And so overall, entertainment is becoming expensive. That's your other thing. And food. Food has come down in cost over the last 15 years, but it's reached its bottom. It's going to start going up more. And again, if you want to eat healthy, it's even more expensive. So overall, your major items like that, especially over the next 20 years, they're going to double. So if you're saying, I'm going to retire and I'm going to have X income, probably your income is going to be more stable, but your expenses are going to increase. So you really have to look at what is your income and what is your, over a period of time. So unless you have $1 million, you don't retire, right? Period. You wait to probably the 70 years.
Okay, very good. Another viewer is asking you today, can both spouses collect full benefits under Social Security? Can they do it at the same time?
The answer is yes, period. At the same time, it's a strategic thing again. It depends on what each person earned. Should the one person wait to file later, because we'll discuss this in a few minutes, the difference in Social Security, the incentives you have to wait till you get your Social Security. And so overall, the answer is yes, you can. Should you right away, that you have to, it's a strategy.
Mm-hmm. And people have to realize the longer they wait to begin collecting Social Security, the more their Social Security benefits
and I'm going to get into that in a few minutes.
Oh, I'm sorry. Well, that leads right on to the next question, Ed, and that is, if I begin to collect Social Security benefits at age 62 or 63, and I later want to change my mind, what can I do? May I change my mind and suspend payments?
Well, actually, it's sort of interesting. Again, it's complicated, as most rules are. First of all, if you change your mind in the first year, if you pay back the money you got, let's assume that you were getting $1,000 a month, and you got it for 10 months. If you pay that $1,000 a month back, the $10,000, now you reset the clock, but only for the first 12 months.
Okay.
After that, you can cancel it. It's a little more complicated, and then you can reinstate, but you will lose a certain amount and so on. As I say, it's because each person individually, it is a complicated process. Yes, you can. That's the answer. You can do it. You have to go and follow the rules. And the one rule is the first 12 months, and the other rule is after the first 12 months.
Well, that's something I've never heard of, and I imagine most of our viewers haven't either.
I was surprised when I did research on it, that there is this 12-month window. And I guess if you don't pay it back, then of course it also changes the rules again. I mean, the answer is yes, you can, but it's not that. It's you have to. Anything you're going to do with financial planning, but it's specifically Social Security, you can go to the Social Security office, which is a busy place. They do have advisors there. And if you're not satisfied, that you don't totally understand their depth of their advice, to go to a financial advisor and help you. It's part of your planning how you're going to use Social Security is a big item.
Absolutely.
I mean, just to give you an idea, which to me it was really interesting. We start to look at if you take your money, and this is maximum. You have to take some number. So we took the maximum. It's $26,000 at 62. It's $44,000 at 70. That's a big difference.
Oh, yes.
So obviously, that really, if you can wait to 70, and now that's of course all based on inflation, it will continue to grow. So you're going to be a lot more money, and therefore, but again, that's, as I said, my first piece of advice was, don't retire early, because Social Security is another item. So but if you can afford to retire without Social Security and let it accumulate, then your finances are in good shape, and you probably can afford to do it.
Okay. Well, if people are looking at other items in their personal finance, one viewer wants to ask you at the current time what you would consider to be the best investments in real estate.
Well, first of all, my answer is I think that economically we are going to have some challenges. Specifically, this is a political statement, but it is, if we have a change in government in the presidency, we are going to have a major negative economic adjustment. Even if we don't, there's a concern that the economy, it doesn't go up forever. We have now had a very long expansion, not actually the longest in some ways, because there's been expansions in the past were a good one, then they had correction, then they went up more. So it isn't really necessarily the absolute longest. But the thing is that our economy is going very well right now because we have a very pro-business government. When you get an anti-business government, you will have a major financial correction. Mm-hmm. So therefore, real estate is an illiquid asset, and so therefore I just don't recommend you period invest in it right now.
Okay, that's surprising, but I understand what you're saying. The last question we have today is, if Representative Cortez's green agenda becomes law, what stocks should I avoid? What type of investment strategy should I adopt if the green agenda is adopted by our national government?
Well, first of all, I do think that...
And we're asking you this with 2 minutes.
Okay, let's put it this way. First of all, when they were passing out common sense or uncommon sense, Cortez didn't get in that line. So therefore, that I don't believe what she is proposing would, even under the Democrats, would become law, because this would basically bring our whole economic system to a halt. And again, will there be pieces of that which will cause some pain, which I said earlier? We're going to have an economic correction anyway. Now, because we always do. I mean, things just don't go up forever.
Right.
But if her thing, so I think the Green Deal is not going to happen. So overall, there's no plan, because if it does happen, there's no defense against it.
And that's when you look for that retirement haven in another country, perhaps.
Well, you're assuming that but I have this biased opinion, and it's just biased. If the world doesn't have America to support it, I'm not sure where the world's going to be. So Costa Rica is doing wonderful, or all these other countries we talked about. But if there's no American money flowing, how well will they do? Mm-hmm. And so that gets more complicated in there. Well, a country like even Switzerland, which is the soundest of all, or Singapore, they depend upon trade. They depend upon selling to the rest of the world. Well, if the rest of the world goes into a major economic downturn, even these countries will have challenges. So that I don't think you worry about the Green Deal. I'm concerned about the overall economy and just generally this anti-capitalist. We're not socialist. We're anti-capitalist is our new philosophy, because socialism is a broad term. Well, of course, we're in socialism right now. Social Security is socialism. You say you're entitled. You get way more than you put in.
Okay. So. Well, on that note, we've run out of time, Ed, for this installment, but we want you to go ahead and send your questions in for Mr. Arnold. Our email address is on the bottom of the screen, and we look forward to seeing you again next week on Behind the Headlines.